Okay, after looking at your family history, it looks like that you have a lot of hypertension in your family. You may not have that condition now, but I just wanted to go over some things with you right now. Okay. Hypertension is also just a fancy name for high blood pressure. Um, Basically, the anatomy of it is when the force of the blood flowing through your vessels it's just too high. Like it's just pushing on those vessels too high. Um, and we kind of want to get that controlled because it can lead to several things such as a stroke, heart attack, heart failure, or even kidney failure. Just a few quick facts. An estimated 1.2 billion adults age 30, which you just turned 30 this year, to 79 years worldwide have hypertension. About 46% of adults with hypertension are unaware they have the condition. Less than half with it are diagnosed and treated. 1 in 5 adults with hypertension have it under control, so they don't even need medications or anything like that. Hypertension is a major cause of premature death worldwide, but we're not gonna let that scare you. So on this sheet, I do have where you can see like the normal ranges. We normally want the blood pressure to be 120 over 80. If it happens to be 120 over 122, 129, it's a little elevated, nothing to be too concerned about. But if that top number, which is called the systolic number, gets up to like 130, we kind of get a little concerned. And if that diastolic number at the bottom gets over 80 and stays that way over time, then that's when it's considered hypertension. All right, so let's talk about what makes you a higher risk of developing hypertension. There are some factors that you can control and there are some that you can't. So let's go over the ones that you can control, okay? No smoking. You don't smoke anyway. Try and stay away from secondhand smoke as well. That can increase your risk. Having diabetes, just kind of maintaining what you eat, different things like that. Obesity and being overweight. I know recently you've been changing your diet, trying to get back right, so you're doing good with that. Try not to have high cholesterol. That also puts you kind of at an increased risk, as well as an unhealthy diet. I know it's easy for us to go through drive-through. They ask us what do we want, and we get it.
It tastes so good.
Yeah, let's try and limit that. Yeah. And also no physical activity. So, just try and walk around as much as you can, get a good bit of exercise. Now, some factors that can be changed, which in your case is a family history, race and ethnicity, age. I know we all wish we could be 20 forever, but real world we can't. Your gender, males are more prone to hypertension than females. Chronic kidney disease and sleep apnea, just sometimes things that we have. Okay? So, how can you tell you have it? It's really hard to know if you have hypertension or not, but it's good to keep it checked regularly. I think your primary, they'll average it out based on like 2 or more readings of your blood pressure. It's also good to try and keep an eye on it at home. But if you have like severe high blood pressure, we're talking 180 over 120. Some symptoms include severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision, anxiety, buzzing in the ears, nosebleeds, and even abnormal heart rhythms. But like I said, sometimes it's very rare to know that you have high blood pressure. What can be done about having high blood pressure? We already said don't smoke, avoid secondhand smoke. You want to try and reach and maintain a healthy weight. Get that weight down as much as you can. And just maintain it. That'll help out a lot. We got to eat healthy. Okay, we want a diet low in saturated and trans fat. Okay, like I said, McDonald's French fries, out the window. We want to try and do fruits, vegetables, whole grains, and low-fat dairy products. We also want to try and limit that sodium to less than 1,500 milligrams a day. And we want to eat foods rich in potassium. And we want to get about 3,500 to 5,000 milligrams per day. We want to limit alcohol. It's okay to have a drink every now and then. Recommended is 1 drink per day as a female. They want you to try and be more physically active. Now, don't just go out there and run 5 miles and die. That's not what I'm saying. It's not what we're doing. We want to get 150 minutes of moderate intensity or 75 minutes of vigorous physical activity per week. So go for a walk for a little bit, just take your time, work yourself up to it. Just don't go out there and be like, I gotta be out here 150 minutes. No, that's not possible. Okay? So also, sometimes, if these things don't work, you may get on medications, such as like an ACE inhibitor that I know pretty well is lisinopril. Most medicines with the ACE inhibitors end in prils, lisinoprils and all stuff like that. Or they may put you on a calcium channel blocker, which another one that I'm familiar with is amlodipine. And also, it is best that you know what your blood pressure should be and work to keep it at that level. Because if you don't know what it is, you don't know what your normal is. We all need to know what our normal is. Okay, so after everything I've said, if you still have questions, I have listed a few websites on here and numbers that you can call. You can call this 1-800-242-8721 to learn about heart disease and strokes, because strokes can come from this. Or you can join a support group. There's plenty out there online that have easy access for that. Or you can sign up for monthly newsletters, heart updates, different things going on in the area. This is just a good reference to have if you need it, forget about what happened, but definitely keep this for your numbers, so you can know what is and what isn't good. And I hope this was very helpful to you.
Yes, thank you.